The next question for you is about addressing domestic violence and mental health. Uh,
Okay.
you, your
Yeah.
experience, okay, your experience includes working with domestic violence survivors in addition to mental health patients. Could you discuss the intersection of domestic violence and mental health, and how can therapists and support systems contribute to breaking the cycle of abuse and promoting the survivors' mental well-being?
Okay. So basically, the statistics are very different and very, very alarming, right? If we are considering not only women, even
Yeah.
men, right?
Yeah.
So 1 in 3, women experiencing physical violence. 1 in 5 women experiencing sexual violence, right? 14% of women, having experiences stalking, right, with their intimate partners. And similar to if I'm considering men, right? So 1 in 4 men are, having experiencing sexual violence, physical violence, and uh, 1 in 14 men, right, experiencing sexual violence, and similar, like 5% of women, also men also experiencing some stalking by their intimate partner. These are some statistics, right? Means this is another a kind of a real struggle, a situation in our society. And when it comes to domestic violence, we need to understand what we are uh, how we are taking this term domestic violence, how we can explain this is domestic violence, this is not domestic violence, right? So basically, there are many things in terms of domestic violence we need to consider. Psychological abuse, emotional abuse, and I'm considering emotional abuse is larger than the physical abuse, right? uh, Financial abuse, and definitely physical abuse, right? All these things. So, and it definitely impacts, right? Mental health, and a lot of studies mention the women who are experiencing domestic violence or any kind of violence in their life, they are more involved in substance abuse, and they have a lot of concerns in terms of mental health, right? So this is a very direct impact in terms of domestic violence. Either you are talking about name calling, yelling, dominance, isolation, denial, blame, anything you can, humiliation, right? A lot of things, right? We can consider in terms of domestic violence, and it has a definite major impact in terms of mental health and other addictive behaviors. Yes.
Interesting. The reason I say interesting is because I never thought, you know, emotional abuse could also be considered as a
Oh
domestic
yeah.
violence.
Yeah.
But it's really something that is really insightful for me at this moment. So thank you for elaborating.
Okay. Yeah. Because low
Um,
self-esteem, right?
yeah,
Right. It break you, right?
yeah,
So we need to consider all kind of things, right? And we need to spread awareness for sure about these concerns. We need to talk openly about these things. We need to raise not only our girls but our boys, right? With openness, right? So this is how we can address like upcoming issues, or this is how we can. So I'm very hopeful in terms of the initiatives South Asian community are taking, like you people, right? So these are good, initiatives, and it will impact in a very positive manner.
thank you. So when it comes to extending our support to survivors of abuse,
Mhm.
domestic abuse, and specifically, is there anything that we could do differently or continue doing?
We need to spread awareness, as I said,
Yeah.
right? A lot of religious places, we can use them. Religious people, we can use them. We need to provide safe places in terms of so people can talk, because um, the controlling behavior of abusive partner, either a man or woman, right? We need to understand this. We need to provide some safe places to talk about these concerns. We need to provide some platforms, right? Religious participation I'm considering, because people are, if whatever they are doing or whatever they are not doing, but they are somehow, in contact with religious places, right? So in terms of their religious, in terms of their culture, practices. So I think the major role, because people are very, in terms of beliefs, South Asian people, how they are,
Yeah.
right? So we need to, I think, consider, focus on this. We have to incorporate these religious people, and so they can educate, right? And different levels, like either as a, as a children, maybe we can provide some platform, different avenues we can use, right? Social media is a big piece, right?
Yes.
So nowadays everyone is using, even older people, right?
Yeah,
Yeah.
that's right.